Good morning, I'm Dr. Raja Ahmad Sharul, Head of Health Screening and Wellness Center here in Beacon Hospital, and today we're going to talk a bit about health screening. Okay, that is a very interesting question. Health screening actually is a process in which the patient or the client sees the doctor to have their medical checkup to find out a bit more about their health. And with all the information that we gathered from the history, examination and consultation, together with the results of the test, we will be able to advise the patient and come up with a program for them to be healthier and also to prevent them from having any other disease. It is very important because nowadays one of the major problems health in the world or even in Malaysia revolves around chronic diseases. These are diseases such as high blood pressure, high cholesterol and diabetes, to name a few. And it is very important for us to prevent this, and one of the ways that we can prevent this is by doing regular health screening. So if someone does regular health screening, these chronic diseases can be detected early, or even better, it can be prevented. And if this happens, then we can have a better lifestyle, the country can be healthier and people can be more productive. And this is one of the major reasons why one should be doing health screening. It is very important because nowadays one of the major problems health in the world or even in Malaysia revolves around chronic diseases. These are diseases such as high blood pressure, high cholesterol and diabetes, to name a few. And it is very important for us to prevent this, and one of the ways that we can prevent this is by doing regular health screening. So if someone does regular health screening, these chronic diseases can be detected early, or even better, it can be prevented. And if this happens, then we can have a better lifestyle, the country can be healthier and people can be more productive. And this is one of the major reasons why one should be doing health screening. As I said earlier, health screening is actually a process. There's a lot of stages involved, and the first stage is that the patient will come and see the doctor. And at this point, the doctor will discuss with the patient and take history from the patient to find out how they have been living. For example, if they have any health problems, or they have any history of any diseases, and also find out a bit about their lifestyle, their diet, any stresses, whether they exercise and so forth. All this information will give the doctor a bit of a picture about how the patient is, what risk that this patient actually have, because obviously one patient's risk is different from another. So after we have all this information, the patient will then be examined by the doctor, and then after that we will proceed to do some blood tests. And again, this blood test will depend greatly on what the doctor found during examination and consultation earlier. After the blood test, we will do some imaging. That means x-rays, ultrasounds, CT scans, stress tests and so forth. These are not compulsory, and again, these differ from one patient to another. Some patients might need to do it, some might not, but these depend again on what the doctor thinks or what the doctor feels feasible. Finally, once all the results are gathered together again, the doctor and also the patient or the client will sit down and discuss the result as a whole and find out what are the risks of the patient developing any chronic diseases or any other problems, how healthy they are, and then we will come up with a program, hopefully to give the patient a little bit of an idea of how to make themselves healthier, how to prevent disease from happening, and hopefully encourage them to have a better lifestyle. There is no hard and fast rule on who should be doing health screening and when they should do it. But in general, if you have a high family history of chronic disease, as I've said earlier, you should be thinking of doing health screening. Currently, the prevalence of chronic disease is getting younger. People having it at a younger age. So definitely, personally, I think if you are 30 years of age, then you would need some sort of medical checkup or health screening. But definitely when you are 40, you would need to have some sort of a more compulsory or more complete package to be done to have a look at your health status. In terms of frequency, again, that differs from one individual to another. If you are at very high risk, then you probably need to do it every year. if not every 3 years after you are 30, but definitely after you are 40, you certainly need some sort of medical checkup yearly. In summary, health screening is something important for you to do to take care of your health. This is because it can prevent chronic diseases and make yourself become healthier. This in turn will prevent further diseases and prevent yourself from being a burden to your family, society, and even your country. If you have further queries, please do not hesitate to contact your own doctor or even come to Beacon Hospital in our health screening center for more information. Thank you very much for watching this video.